Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and today we will talk about very important topic, obstetric emergencies. Our lecture is divided into 5 sections. In the first section, we will talk about the collapse patient and sepsis. And besides talking about collapse patient and sepsis in this section, we will first talk about the different obstetric emergencies and how we can prevent and manage those obstetric emergencies. And then we will specifically talk about the sepsis and its management. Then in the second section, we will talk about the obstetric hemorrhage. Hemorrhage is the bleeding. So bleeding that occurs during pregnancy. What are the different types of hemorrhages? We will talk about 3 very important common causes of hemorrhages during the pregnancy: placental abruption or abruptio placenta. Then we will talk about the placenta previa and vasa previa. These are 3 very, very common cause of obstetric hemorrhage. Then in the third section, we will talk about the antepartum and postpartum hemorrhage. And what are the causes of antepartum hemorrhage and postpartum hemorrhage, and how we can diagnose and manage these 2 problems. Then in the fourth section, we will discuss the uterine inversion and the rupture of the uterus. We will talk about what is uterine inversion, what are the different types of uterine inversions, what's the management of uterine inversion, and also we will talk about the uterine rupture and impacted head at cesarean section. All these are different complications or emergencies which can occur during pregnancy. And then in the fifth section, we will talk about some miscellaneous conditions which include eclampsia, umbilical cord prolapse, shoulder dystocia, and also thrombosis and thromboembolism. So all these are very, very common obstetric emergencies, and obstetrician and the staff who deals with these obstetric patients, they should know how to manage these emergency conditions, because even now with all these advanced technologies and techniques, the mortality rate of the mother and the fetus is very, very high. You will see later on how high it is. So proper education of the staff is required to manage these emergencies which can cause these high rates of fetal and maternal mortality and morbidity. So to learn about how to manage these and what are these emergencies, keep watching sqadia.com.